Hello, everybody. Welcome, Dr. Bobbio. Thank you so much for being on our podcast. I'm so excited to have you on. For everyone that is listening, this young doctor has gone from being a very tentative and what will we say, Dr. Bobbio, maybe a little bit scared associate
Timid,
to
timid.
a timid associate to now a successful business owner with a booming dental practice. So I'm so excited to have you on, Dr. Bobbio. Thanks for coming on.
Thank you so much for having me. I really appreciate it.
Absolutely. For those that don't know you, Dr. Bobbio is a dedicated and skilled dentist here in Northern Virginia. Dr. Bobbio's journey from an internship at a dental startup to over a decade of compassionate dental practice has been marked by her commitment to helping others. After completing her dental degree at VCU and a residency at the Veteran Administration Hospital in Baltimore, she's built a practice, a very successful practice, I may say, known for heartfelt care and excellence in patient wellness. Beyond her practice, Dr. Bobbio is a family person who enjoys spending time with her husband, Ryan, and their three children. She enjoys traveling, exploring Virginia wineries, gardening, staying active with yoga. So thrilled to have you on. Thanks for being on.
Thank you so much for that amazing intro. That was very
Yeah,
kind.
absolutely. Well, tell us a little bit about your background. I know you have deep roots here in Northern Virginia, but yeah, a little bit about your upbringing and how you got into the dental industry.
Sure. So, yeah, I grew up in Northern Virginia. I've been in Northern Virginia ever since I was 8 years old. I went to Virginia Tech for undergrad, and I was a biology major. I really didn't know what I wanted to do with that major. I was thinking maybe pharmaceutical sales. I was even thinking of teaching. And I just needed a summer job. It was the summer before my senior year of college. And it was just a connection. My father worked for the government, and one of his colleagues, it was his colleague's wife, was opening a dental startup in Centerville, Virginia. And she just needed someone to work the front desk. So that was my summer. I worked her front desk, and I was so curious about what she was doing in the back, and I kept just wanting to be in the back as much as I
Uh,
was always in the front. And I would ask her a million questions. And I was like, I don't know, could I maybe apply to dental school? What's the process like? So I went back to Virginia Tech, and I realized I would have to stay one extra semester to get the prerequisites. And I got really, really lucky that I was accepted to VCU, which is in Virginia. And yeah, the rest is history. I have no one in my family that is a dentist. It was really just that summer experience that really intrigued me, and I just loved the combination of science, and there was also art and working with your hands, and I was really interested.
Oh, wonderful. Was there working at your at that first practice at the front desk, was there like a defining moment where you're like, "Oh yeah, this is what I want to do." Was there a special patient, somebody that really influenced you, anything like that?
I think that there were patients that I could tell that we had impacted their life, right? Like we had actually made them have a better day by fixing a tooth that was in pain or changing their smile. And I was like, oh, this is something I could see myself doing for a very long time. And yeah, I think it was just that interaction with the patients themselves.
Okay. And so growing up in here in Northern Virginia, obviously you're now have built your career here. Um, how has maybe, Northern Virginia, how has this area shaped, you personally, professionally? You know, Obviously I know you're very entrenched with the local community as well. So, how has that played a role being from here and growing up here, going to school at Virginia Tech and then VCU?
Sure. No, I feel very, very fortunate. Even where I went to high school, it was just like super diverse. I really was able to have a mix of different cultures and learning from different people. And I was very fortunate to have just a really good, solid group of people around me as I was growing up here in Northern Virginia. Um, I think that Virginia Tech is such a phenomenal school. For me, that was actually a totally different environment. Going down to Blacksburg, Virginia, that to me was almost a culture shock. And then, I was in Richmond for 4 years, downtown Richmond. And then I was in Baltimore for a year. And I just think having the experience of living in different places has given me the benefit of being able to connect with so many different people from so many different backgrounds, and just having that diversity that started here in Northern Virginia was really foundational for me.
I love that you worked at the Veterans Administration Hospital. Jasmine and I, we were even thinking about starting a nonprofit for veterans. But tell me how your experience was there. How did you like your time there in Baltimore?
It was probably the most incredible experience in terms of building my confidence, and also working with patients who had post-traumatic stress syndrome. They were medically compromised, and like just the most amazing people, right? Like they had served our country. They'd come back, and life was very different after coming back from being abroad, and all sorts of I learned so much about dentistry, um, that I don't see in Northern Virginia. So it was almost like just a high intensity of medically compromised patients and doing dental procedures that are really challenging. So for my confidence and working up my speed, it was great. And then I also met so many different veterans from so many different backgrounds.
How has that experience, working with those types of or that type of demographic influenced you, fast forward now to today? Do you use any of that experience in your current practice treating your current clients?
Definitely. So I feel that a lot of the veterans that I had worked with had some anxiety and dental phobia. And here in Northern Virginia, there's a lot of dental anxiety and dental phobia. And I just have so much empathy for that. And so I'm constantly just trying to give my patients like the most comfortable experience ever, because I know most patients don't want to be there. They don't want to, they're terrified. They think we're going to hurt them. And so I just try my absolute best. And I try to use so many different techniques, to try to keep my patients as comfortable as possible.
So why that I've never been I don't understand I know that dental phobia is a thing. I just was never terrified of going to the dentist. Obviously people think you're going to hurt them, but what do you think are people's main fear? Is it that it is going to be painful, or they just is it the unexpected? What in your experience, what do you find, why are people so scared to go to the dentist?
Sure. It's usually stemming from a previous experience when they were a child. So some sort of traumatic experience, or something triggers them, and it just reminds them of an experience that was uncomfortable, and typically it's something that happened when they were younger. And
Mm,
it's not always dental related. It can also sometimes be a trauma, like from the veterans experience. So yeah, just trying to constantly keep a calm environment when we're working on them.
got it. Well, now that we've known each other for a little bit of time over the past few years, first of all, tell us I know you were an associate for a practice or multiple practices, correct?
Correct.
And
Multiple.
yes, and so first of all, tell us what that was like. What was that, now that you have both perspectives, because you have the perspective of being an associate, just like myself, and obviously now as the owner, but from the perspective of as an associate, how was that those years you were an associate working for somebody else?
Sure. So those were like learning and growing years for me. And I also was building my family. So I do see a lot of the benefits that it did give me. And I learned so much from the doctors that I worked with. And it really was the psychology too of learning how to interact with patients. Even though I had done my residency at the VA hospital, now I had to come to Northern Virginia and get an idea of how to read patients and how to have conversations with them. But I did quickly want to be able to make decisions. I realized working for somebody else that, the philosophy, the materials, the systems, they were all that of the owner, right? And
Mm,
so I quickly realized I kind of wanted to do things my way. I wanted to
yes.
have my own philosophy. I wanted to build my own systems. I wanted to use materials that I thought would be, better or faster.
Hmm.
And you just can't do that as an associate.
Yeah. Yeah. So you don't have as much control. I felt the same way. Now, the previous owners that you did work for, What are some of the things that you did learn? Like, obviously, you wanted to do it your own way, but were there some things that, what do you feel like you benefited from while working as an associate?
Sure. So I think just seeing so many different cases and seeing how another dentist would tackle that case and the philosophies that they used, even the verbiage that they would use when they're educating a patient, right? We have all these dental terms and sometimes we'll talk in dental lingo, but patients don't understand what you're talking about. So even just learning how to convert that into a conversation that a patient can understand and how you can genuinely educate a patient, I learned that from the dentist that I work with. I learned even some of the business stuff from the dentist that I work with in terms of, they were always looking at the numbers and trying to manage the schedule. And I would observe all of that. And I definitely did soak some of that in.
And then, what are some of now that you've been in the field for so long, what are some of the changes you've seen as far as, you know, techniques, services that I mean, dentists now are providing so many other services besides just, you know, I don't know, I guess the standard like cleanings and things like that. What have you seen over the years? How have the advancements been able to help your clients or help patients in the dental field?
Yes. So the technology is just constantly advancing, and digital dentistry is absolutely amazing. You can do so much now with an intraoral scanner, and you can design things on the computer. There's now even AI that can look at x-rays and can help you really detect where cavities are. It's just constantly evolving and changing, and the benefits are always to the patients, that they don't have to have such a like messy impression, and they can have more predictable results because of the technology that's advancing. I would say that's my favorite part, is now the digital part of it.
Hmm. And how does it benefit you as the doctor? It benefits the patient because they get better results. As you as the provider, how does it benefit you guys?
Well, it's more predictable. So, and
Yeah.
it's quicker, faster, more efficient, and more accurate. So sometimes, let's say you were taking an impression with a traditional impression material and it doesn't capture things exactly that way. That may result in multiple appointments and having your patients have to come back and forth.
Hmm.
Whereas now, if you can get something that's really super accurate and you're working with a lab, you may just, dial that down to just 2 appointments instead of
Sure.
like 3 or 4.
And so fast forwarding now, you opened your practice 2 years ago?
Yep, we'll celebrate our 2-year birthday November 14th.
Congratulations. That's
Thank
amazing.
you.
And just so everybody knows, the timid associate who was afraid to open her own practice now has a waiting list because she's such a rock star.
Thanks,
So,
Dr.
what is
T.
your
You
waiting
helped me
list?
build my confidence.
Your waiting list is now like a month out?
Yeah, we're a little over a month out.
Wow, good for you. And
Thank you.
now that you have a perspective as a practice owner, for all our other, viewers that are listening that are scared to go, maybe we talk about that. What were some of the fears? What were some of the things that you were afraid of, when you were an associate to go out on your own and start your own practice? What were the things that obviously family, is a big factor, but what are some of the other factors that you thought were maybe standing in your way that or preventing you from, going out on your own and opening you up your own practice?
Sure. So I think one of the biggest ones was financial.
Yeah,
I was afraid,
yeah,
like,
yeah,
I'm gonna not gonna have any patients. It's not gonna be successful. We're gonna have to live in my parents' basement. Like, just these like huge financial risks that
yeah.
were very scary for me. I think also just having more self confidence in myself, believing in myself to be a leader. I definitely questioned whether I could lead like a team of people. Um, yeah, I had a lot of fears, but the biggest ones I would say are financial, self confidence, and yeah, just figuring it all out and balancing my family plus being a business owner.
Right. And so going through that process, tell us more about that. How did that, because I know that you were probably still working as an associate as you were getting the new business up and rolling. What was that like?
Sure. So I realized that one of the biggest things I had to do was just even though I was scared, I just had to do it anyways. Like I got to a point of where I just I had to like work through it. I still was scared, but I was just like, I'm just gonna do it because I got to the point where, right, like frustrations lead to breakthroughs. I got so frustrated that I knew if I wanted to evolve and grow, that I had to make this jump. And then working with as an associate while I opened the office was just it was extremely stressful because I
Mhm.
was, 50% of my energy and attention were at the other office and 50% was at my startup, and I was wanting that to grow faster. So it really wasn't until I 100% invested in my practice that my practice really started to grow.
If you had to do it over again, would you do it differently?
I definitely would have transitioned into my practice 100% earlier.
Hmm. And how did your husband, how the kids, how did everybody react to, or how did they handle that when mom was super busy, when mom was super stressed? How'd you how were you able to balance that?
Yeah, and that's the thing is you think like, "Oh, they're gonna be all frustrated or stressed that I'm not," it was quite the opposite. My kids were so supportive. They were so excited. They would come into the office and they thought it was like the coolest thing ever. I got like little like goodies for the kids when they're, after they're cleaning, and I got like a vending machine, and they were so adorable and helped clean the office, helped me set up. My husband's same was just like felt like this was like a family investment, and they were all super supportive.
Okay. And so pretty quickly you got pretty busy, I would say, right? Like after you guys open, so you opened in November 2 years ago, so 2022 in November you opened. And then did you have staff? Did you hire everyone after you opened? I know some family helped out, but how was the growing process of your practice? How did that kind of pan out the first maybe 6 months or so, first year?
Sure. So I had hired my office manager before I opened. We had a lot of delays because not only was I doing a startup practice, I was in a brand new building, and that brand new building had so many issues before we could actually get the permitting to get started. So I had hired her within in anticipation that we were going to open. She actually was pregnant with her second child, and she was going on maternity when we were going to be opening the office. So I actually brought in my mother to help out in the very beginning. And it was just me, and my mom helped, and then I had a hygienist and one assistant. And we were just a small crew for probably a good 6 months. And then my office manager, she came back around 3 months after, after she had the baby full time. And then we were starting to grow our team after that. And once I transitioned from my associate position, that's when we really started to grow the team.
So when you opened in November, when did you finally stop working in as an associate at the other practice?
It was 6 months. It
Yeah.
was at least 6 months. So I want to
Okay.
say in the spring. So like April, March or April.
And so at what point did you flip switch in your brain where like I don't know, I feel like when I had a very similar experience. I was working 3 days a week at my other practice. I was 2 days a week as an associate, and then I was opening my, office 3 days a week. And how long did it take you till that switch flipped in your brain and you were like, okay, all of a sudden like, okay, I can do this. Like this is happening. We're gonna be fine. Did that take 6 months? Did it take a year? Or was
Um,
it like
yeah,
how
it
quick?
honestly probably was like 6 weeks. Like probably
Yeah.
like I was terrified the first 2 weeks. I didn't sleep. I would wake up at 1 o'clock in the morning and stay up till 5 a.m. And then I would go back to sleep for like the first 2 weeks. And then it just started to get a good rhythm. And I realized, okay, we're gonna be able to be okay. And after about 6 weeks, I was like, I could probably just 100% be at my office and we're gonna be just fine.
That's awesome. So, a lesson to all the entrepreneurs or the wannabe business owners out there. Number one, Dr. Bobbio has named There is always unexpected surprises, right? Like you had
Yeah,
no idea the building you were going to go into had all the. What type of issues did you run into? Because this is good, great, helpful tips for people that are going to try to open their own business. There's always some sort of hiccup, right?
correct.
Some of the things that you had to overcome because you were in a brand new building, right? And they were still building it, I guess.
Yep. So it was really the permits. So not only did I have to have my permits for my space, but the building itself it had to pass its own permits. The fire alarm, which is something that I didn't even realize could delay you. It was like that darn fire alarm did not pass permitting and put me back like I don't even know how long. But I remember I was like, just get this fire alarm to work.
Yep.
So I think any new construction, there's always delays.
Hmm.
Like, and it was double because it was right the building and then my space.
Yeah.
But the
Okay.
one that I remember the most is the fire alarm.
The fire alarm was we it's so funny because we have fire alarm testing. I don't know if it's the same in your building, but like we get our fire alarms tested like once every few weeks it seems like, and I'm like, why are we getting tests all the time? I'm sure
Yeah,
it's important, but
I'm with
um
you.
all right. Well, now that you've got your practice, you're up and going, what are you doing now that previously as an associate, you felt handcuffed, you felt like you were restricted? Like, what are some of the things that you now implement currently in your practice that are is different than what you previously did as an associate?
Sure. I think the new patient experience, all of my systems, like I was not able to implement the systems that I would like as an associate. The materials that I use, even the equipment that we use, I'm able to select which one I think would be the most efficient, and what's going to be best for the practice. But I think just systems in general. I get to create those systems and I get to implement and I get to execute. That was the biggest thing. I'd have all these ideas, but I could never execute any of them.
And your office looks amazing. For those of you who haven't been to Dr. Bobbio's office, it's Bobbio Family Dental in Brambleton, Virginia. Um, It looked amazing. So Dr. Bobbio also had an amazing grand opening. Tell me about the grand opening. What went into that? You had a phenomenal turnout. When Jasmine and I pulled up, I almost cried because I was like, this girl has done it right. So tell us about the grand opening, what that entailed. Your decor in the office is absolutely flawless. It looks amazing in there. Tell us a little bit about that as well.
Well, thank you so much. Yeah, no, we wanted to have like a big party. We wanted to really, really celebrate. And we waited. We waited, I think it was April. So we
Yeah.
opened the practice in November, April or May. I can't remember the date right now. Um, but we wanted to have a big party and we wanted everyone to feel welcome. So we ended up having Kona Ice come. We had, we raffled off prizes from you and other, businesses that we are in relationship with. We had like all sorts of food and we had wine tasting upstairs in the office. I wanted people to be able to come into the office and be able to see it for themselves, and if they wanted to have some wine, it was there for them to taste and to try. And we had tons of stuff for kids. I wanted it to be super family friendly. I have 3 children, so I wanted them to have a good time. And usually when the kids are having a good time, then the parents are having a great time too. So yeah, no, but I was just super grateful that you all came also to help us celebrate. And we went big.
Well, it's definitely probably one of the best grand openings I've ever been to. And it's very common too. People think that like they need to have their grand opening like right when they open, but it's almost better when you wait. You get some time to kind of build up your patient base, get a little community. Speaking of community, how is the Brambleton area? What types of relationships have you fostered? How has that helped your practice grow since you're now on a month waiting list? Have you been able to build those types of relationships in that community?
Yes. So we are technically in a 55 and up section of Brambleton. It's called Birchwood. And the patients and everyone involved in that community have been like out of this world supportive. Even in our building, asked us to be involved in many events that they're having. And we're going to be putting on a speaking event. So there's just so many opportunities, and they are constantly supporting us. So all of the patients are awesome. They can walk to our office. So, I mean, that just makes me really happy.
Oh, all right. And how about in the practice itself, I know you now have you're very, very busy. What are some of the things or treatments or services or techniques that you like to focus on within the practice that outside of just the stuff you were doing as an associate?
Sure. So I think bigger cases and like more smile transformations are what I'm focusing on. I'm also very much interested in airway and sleep. I have lots of family members that are not good sleepers, so I am very much interested in that and constantly checking airway and seeing how I can incorporate that into my dentistry. But I'd say just bigger cases that I wasn't able to do as an associate, and really taking more continuing education classes so that I can become even more skillful in those big cases.
And what is the smile transformation? What does that entail? And what does, or even the airway stuff, like how how does one know that they have an airway obstruction, or how would you go about correcting that with a appliance, or how do you handle those types of cases?
Sure. So usually a patient will like present to you with just like really worn dentition. So like really worn down or lots of chipping, lots of fractures, things like that. And typically what's associated with that is clenching or grinding. And if you get down to the root of it, a lot of times patients are like, "Well, I'm snoring at night. I have all sorts of, uh, times that I wake up in the middle of the night. I'm not sleeping well." And they're really all associated with each other because if you're not sleeping well at night, and your body is going to try to get more oxygen and compensate by you clenching and grinding and moving your jaw forward and backward. So it's all related, but usually patients will just present and say, "I just want pretty teeth. I just want my teeth to look nice," right? Like I don't
Mm,
like my chipped or fractured teeth, and um just fix my teeth. But there's
yeah, yeah.
obviously more of an underlying, reason there. And a lot of times what we have to do is we have to like, do rehabilitation and reconstruct the smile, and we have to correct um the vertical dimension, which is opening up that patient's bite, because over time, from grinding, chipping, they've worn down that dentition, and that decreases that vertical dimension. So you have to really rebuild the smile like you're building a house.
Mm, okay. Dr. Downs, do you know Dr. Downs by any chance?
That name sounds very familiar.
He's big in the sleep. He's a dentist,
Yes.
but he's like
I
that's
think
all
I
he.
met him. Was he in
Yeah,
BDC?
yeah, yeah.
I met
Dr.
him.
Downs,
Yes,
he
I
was
met him.
big. Um, he's got all the different, oral appliances that open up the airway, but he's definitely whenever you said sleep, I was like, oh, I always think of Dr. Downs because he was the like Sleep Balance Academy is I think what he does.
Very cool.
So awesome. All right. Well, what do you feel like, you want to have? What type of impact, Jenny, do you feel like you have had or you would like to have on your community, in regards to obviously your practice, being a business owner, you have a big impact on your community, but even like personally as well. What's kind of the goal or the mission or vision of your office?
Sure, yeah. No, I genuinely want to change people's lives. Like I want them to feel like when they come into our office that there's this like positive, amazing energy that we genuinely care about you. I genuinely want to listen to your concerns, your needs, and tailor our treatment based on your needs and your concerns. And I want you to have some fun too. One of my core values is to have fun. I want to constantly 10x my fun. So, so yeah, I really want to change people's lives, and my team feels the same way.
And what is one takeaway you would love everyone in your community to know about the importance of dental health? Like, what are you constantly telling people? I know some other dentists that we may or may not know always says, your um, your mouth is the entry to your, what is that saying? Do you know what I'm talking about?
I don't know her saying.
Your mouth is the gateway to your health or something like that. She
Well,
always tells me.
yeah, that's
But
true.
like, what's the
That's
one
true.
thing you tell your patients
Yeah,
all the time, about the importance of dental health and why it's,
yeah.
important for them?
On that same note, right?
Yeah.
It's connected to your overall health. So patients who have like gum disease, there's a strong association with cardiovascular disease.
Ah,
Um, not if you have an underlying dental infection, like your body's spending energy fighting that infection. If you're going to the dentist every 6 months and you're staying on top of it, that's taking care of your overall health. I always tell my patients, I'm like, you need your energy for other things. You don't want your body fighting this infection here. Like you have a lot of things to do. So taking care of your dental health is taking care of your overall health. And we all know that health is wealth. So
That is 100% true. I've got one tangent, and I think I asked you this before. Is that so? If oral health or is related to cardiovascular health, what is the correlation between root canals and like heart attacks? Like, because I know that's a big controversial topic, right? Like,
it sure is.
people who have root canals, some studies show that there's a direct correlation, or some people say, oh, it's like an indirect, or it's just.
Yeah, I think
Can
it's
you
the
explain?
trapped back. Yeah, sure. I think that the process of a root canal is when a tooth is infected and the nerve becomes irreversibly inflamed, and that leads to a dental infection. So if you're trying to save the tooth,
Hmm.
what you do is you do a root canal and you have to remove that nerve and you have to use irrigants to clean that entire canal.
Hmm.
And then you fill it with it's called gutta percha, which is like a rubber based material in that canal. What that does is it saves the tooth. So I think that what's happened is if a root canal is not done properly, is that bacteria can still be harbored inside of that canal, and that can absolutely lead to cardiovascular disease. Um, if a root canal is done properly and it's done very well, which most specialists, endodontists, and general dentists who do root canals, I don't believe that I genuinely don't believe that it causes cardiovascular disease. A well done root canal. And what I like about saving a tooth, I'm so much in the business of saving a tooth, is that when you lose a tooth, you actually start to lose bone because the bone supports the tooth and then the tooth supports the bone. There are great options if you have to lose a tooth. There's dental implants now, which are fantastic. Um, when an implant heals in your body, it will stay with you the remainder of your life. And you just have the crown itself, sometimes you have to change out every 15 years or so. But there are great options if you're going to have a tooth extracted. But if you want to save a tooth after a tooth has had a cavity that's gotten all the way to the nerve, then a root canal is definitely a great option. And we see root canals, and I probably need to do my own anecdotal like research, but I've seen so many patients that have had great root canals and have no cardiovascular issues. So I think the jury is still like, I don't, the jury's still out exactly on that. But my thought process is if there is a connection, it's from a root
Poor.
canal that's not done properly.
And so it's not done properly, so the bacteria is still in the root, and then that bacteria over time causes the cardiovascular issues. Are there
Correct.
any products that dentists may have used in the past that have been toxic that would cause heart issues in your experience, or any literature that you know on that?
There is some that we don't use anymore, like formocreosol. There are some. What's nice about evolving is that there are a lot of materials that were not great for us that are now, there is more of a leaning towards a holistic approach. So I think all of the products are getting better and better, but definitely root canals using formocreosol was, a toxin.
And what about like metal fillings? Are metal fillings like have mercury in them? And is that a danger, or is that more just like, do people still do metal fillings or no?
Sure. So people do still do metal fillings. They do them in settings such as like very rural areas, in prisons, things like that. And amalgams, metal fillings do have mercury in them, but what is toxic is the mercury vapor. So that's why we use suction. We use so many things when we're removing an amalgam because that's actually what can be more toxic. But even when I was in dental school, I graduated in 2010, we had moved away from amalgam. I was still doing amalgam in dental school, but by like my senior year, we were doing composite fillings. So moving away from that. So you'll rarely see a dentist in private practice placing any silver fillings.
But so I won't get arrested and get my filling done in the prison. If I'm
No,
in the
please
public,
don't
we
do
should
that.
be good. We should be good to
Please,
go.
Dr. Keith, don't get arrested. I'll have to
Okay.
come visit you and I'll do your fillings.
There we go. There we go. All right. Well, now that you're such a busy dentist and you're so successful with your practice, how have you been able to balance, the three kids, the husband? Now that you've got 2 years under your belt, things are, well, and maybe not. I might be wrong. You tell me if I'm wrong. Is life more manageable now? Are you able to spend more time with the kids? How have you been able to balance that since you opened practice 2 years ago?
Sure. So that's definitely a work in progress. But I do have a couple of things that I focus on that I do think help me. I always try to be super present. I always try to be where my feet are. So, like, if I'm at work, if I'm with patients, I really focus on being with my patients. If I'm home with my kids and I'm with my husband, I really try to focus on my children and my husband and my family. The other thing is sleep. I have to have really good sleep. Like that is what has genuinely gotten me through these first 2 years of a startup. I've thought about it a lot. I'm like, what? It's like getting good rest and getting good sleep and recharging. So yeah, I'm very passionate about sleep.
So tell me about sleep. What is some of your sleep? What are your sleep routines? How do you get a good night's sleep? What are some of the things you do?
So I'm someone who loves to stay up late and like definitely scroll on social media and like just let my mind go a million different directions. I have to literally kind of like yell at myself and say, go to bed. Like you need to go. If I can go to bed early, I will have a great night's sleep and I will sleep
Yeah.
very well. I have in the past because again, airway. I've taped my lips before to make sure that
Ah,
I breathe through my nose. Lip taping is one.
Jasmine. Jasmine's gonna love this part. Keep
Yeah.
going.
There are, even like listening to a meditation, having a tea. Like I love a good nighttime tea. Not watching TV, not being on my phone, and just putting myself to bed at a decent time. That's honestly the best way for me personally to get a good night's sleep. Um, but yeah, there are, just so you know, my husband has severe sleep apnea. And
Mm.
the gold standard for someone who has severe sleep apnea is a CPAP, but a lot of patients, they will not tolerate that CPAP. And that's when you have to look at different modalities. And we make sleep appliances that do position your jaw slightly forward, that can help keep your airway open while you're sleeping at night. So there are so many different ways to try to get better sleep, but you have to know where you are in terms of airway and if you snore and things like that.
So let's go back to the mouth tape. Tell us about mouth tape. Why is mouth tape important, and what does it help us do to help improve our sleep?
Sure. So, mouth tape forces you to breathe through your nose, and that's how you can get the most optimal amount of oxygen while you're sleeping at night. So, what happens is we desaturate at nighttime, and if we're not getting that proper oxygen, it just causes a cascade of things. And actually that's a correlation to cardiovascular issues because you're not getting that proper oxygen. So your body starts pumping thicker blood. Your blood is deoxygenated and it becomes thicker, and that makes it harder on the heart to pump that thicker blood. So yes, there's so many benefits to mouth taping, especially if you feel like you're not getting a good night's sleep. That's like a super easy conservative thing to do. You can buy like skin tape. You can buy the sensitive 3M skin tape off Amazon. Little piece of tape, put it on your lips. Your partner or spouse is very happy because you can no longer chat or talk.
Jenny, for y'all that don't know, Dr. Jenny Bobbio's got the gift of gab, everybody. She can talk. Um, so shout out to Lauren Bott. So I had no idea about mouth tape until Jasmine put me on to Lauren Bott. Do you know the Skinny Confidential podcast with
I
Lauren
do.
Bostic?
I do. I'm
Okay.
not as much of a regular as I'd like to be, but
So
yes, I am.
they go deep. She made her own mouth tape,
Oh, I
and it's
love
like
that.
very cute. It's very pink in the shape of
Oh,
lips, so
I
it
need to get some
looks.
of that.
Do you know if there's any correlation or any significance to mouth tape helping like cosmetically with like your jawline, or like because your mouth is closed, it causes you to have like a better jawline because you're not obviously opening, sleeping with your mouth wide open and like snoring away.
There are definitely connections there, 100%. Um, because Well, and especially if you were younger as you're growing, that can actually help remodel. But I do believe that as you're breathing more through your nose, that helps the anatomy and the structure of your jaws. And you'd be surprised, even just a little bit of pressure of your tongue towards the roof of your mouth, because you're more likely to keep your tongue to the roof of your mouth when you're mouth taping, how that can help kind of reform your upper jaw a little bit. So, yeah, I definitely see a connection.
And this is not just adults, right, Dr. Bobby? This can be kids as well, because my nephew, my sister will not believe me, and I hope she hears this. My little poor little nephew, he is, I mean, he's now like 12, but I even when he was like 7 or 8, I would notice. First of all, he always has bags under his eyes. So I'm like, why are you so tired all the time? Like, obviously, he's a growing boy, but like, he sleeps with his mouth open. And like, I could hear him, like, not like a full, grown man snoring, like with sleep apnea. But can kids have sleep apnea?
100%. And there can be so many reasons why. So it's always good to see a dentist and even sometimes an ear, nose, and throat doctor because there can be so many different reasons. It can be just soft tissue anatomy, it can be tonsils, it can be, maybe something in the septum, it could be allergies even. But yeah, just you would get the most benefit as a child or an adolescent from mouth taping because as you're growing, that's what helps form the jaw. So kids 100% can have sleep apnea, and a lot of signs and symptoms are really closely related to kids where they're seeing sometimes like some ADHD is actually sleep apnea related. So not getting a proper night's sleep. So like agitation, even sometimes bedwetting, things like that. So we're learning so much. It's so up and coming. It's been around for a long time, but the
It's
information is still evolving, and I'm really fascinated by it all.
Oh, and I feel like it's often overlooked, right? Like, I know that sleep apnea is extremely, extremely common in adults, but like with kids, you just think, oh, the kid's tired and he's cranky. He doesn't want to go to school. Everyone like doesn't think the kid has sleep apnea, right?
A hundred
Um,
percent.
and especially with kids, a lot of times kids get braces, right? Will braces or Invisalign or anything like that, will that help is sleep apnea in kids, could it also be related to their um, tooth structure? And when will braces help to fix that or not necessarily?
Actually, yes. So typically, whenever a child is going into braces or Invisalign, they're going to get some expansion. They're going to usually typically do expansion because the majority of the time, when teeth are not in alignment, it's because the jaw is narrow. Another thing that can cause a narrow jaw, which all three of my kids did, was that they had pacifiers past a certain age. Kids that do a lot of thumb sucking till they're past a certain age can cause the jaw to be a little bit more narrow. And so typically with braces or Invisalign, we're automatically going to expand the jaw, and that automatically will expand the floor of the nose, which automatically is going to open up airway even more.
Mm.
And just like I was mentioning earlier about like smile rehabilitations and you're increasing that vertical dimension, typically with braces or Invisalign, you're also going to open up that vertical dimension, which automatically opens up the airway as well.
So what are some of the signs and symptoms, maybe more, because we know, well, maybe we don't know, but in adults, it's, snoring, it's gasping for air in the middle of the night. Um, Obviously, cardiovascular disease is very related to that or correlated to that. What do we see in kids that aren't getting sleep because of an airway issue?
So, well, at nighttime, you'll see kids, they won't stay still on the bed. Like they'll be all over the bed. You'll see them flipped upside down. They're just all over the bed. Grinding. Kids that grind, that's also another sign of having airway issues. As you mentioned earlier, the bags under the eyes, um, irritability during the day, and bedwetting are all signs of a child that potentially could have some sleep apnea going on. Any snoring in a child is actually not normal. So snoring in kids is a red flag right there to at least have a chat with either a dentist or, like I said, an ENT or even just the pediatrician about that because that is not typical and not normal.
And Dr. Downs told me snoring in adults is not normal. Like adults should not be snoring. It's usually an airway issue.
It's like I want to say it's almost 90% an airway issue. There's very little, there's like a very small percentage of patients that do snore that just,
Sn-
have benign snoring, but the majority of the time there's airway obstruction, airway resistance, some sort of airway issue going on.
This is great. Um, Now, have you given your husband some mouth tape for his sleep apnea?
I mean, he needs more than mouth tape. He needs that appliance. And the mouth tape, actually. I'm going to do the combination.
But wait, isn't the appliance to open his airway? Doesn't the mouth tape close your mouth?
Well, you'd be surprised. Your lips can still come over that appliance. It will move the jaw slightly forward, but your lips can still technically close.
So you put the mouth tape on. Yeah, you just, it's like shoving food in his mouth and then taping him shut. He won't be saying much at all after that.
I'm like the nicest wife ever.
All right, honey, we're gonna put this in your mouth and then don't say anything. Zip, zip it up. All right, good. Well, this has been great. Last couple things. Looking back on your journey, what advice would you give to a young dentist, maybe like yourself, maybe they've been an associate for a few, or maybe they're right out of school. What advice would you give to a younger you, Dr. Bobbio, who maybe they just graduated or they've worked a couple years as an associate and they're thinking about going out on their own, being a business owner, having their own practice?
Sure. I would say first and foremost, you need believe in yourself. Just like genuinely believe in yourself, that you can do this. You really just need to immerse yourself in the education and surrounding yourself with people who have also done it before you. I got to spend some time with you, Dr. Keith. You inspired me tremendously. You believed in me, which made me believe in myself. And you shared your story and your journey and your experience. And, that just made me think, oh, well, maybe I can do this. So you need to believe in yourself. You need to surround yourself with people who've done it before you. Listen to podcasts, watch YouTube videos on the thing that you're trying to do, and you're going to be scared, and you do it anyways. You do it anyways. Even though you're scared, you just do it anyways because the reward is so much higher than your fear.
What are some of the things that you love about being a business owner now that you never like? Because everyone, when they're an associate, or maybe when, some dentists are in school, they're like, oh, I want to have my own practice because I'm going to be able to make my own hours and I get paid all the money. But we all know that's not true, right? But what are some of the benefits that maybe you didn't even see before that now you're like, "Ah, I'm so glad I decided to do this."
Yeah. So I think the impact, the genuine impact that I can have, not only on my patients, but my team members, and growing these team members, and really being able to, like I said, I had ideas, and actually genuinely being able to execute them. um I think that there is so much benefit, and also being able to structure the schedule. If there are, I look at the year ahead and I can say, okay, days that we are going to be able to take off for a holiday or things like that, and having that ability to do that. And that for my children, the hours during the day, and when I get to be home with my family, I typically used to work evenings and weekends, and now that I'm the business owner, I can structure a schedule that allows me to be home with my kids and have dinner with my children. But I think having the impact on my team has been one of the biggest benefits ever.
Speaking of team, what are some of the qualities you look for in a team member when you bring them onto your team or when you hire them?
I think one of the biggest qualities is positive energy. Like, I think there are so many skills you can teach, but just like your energy is something you can't, like, and your personality. So someone who has positive energy, someone who is definitely eager for the position, um, that right off the bat is like you're almost hired. Obviously, high standard of care is really important, and having the ability to connect with others, and the ability to be a good communicator. Those are key for me.
Awesome. So if you want a job at Bobbio Family Dental, that's all you got to do. I can put in a good word. Dr. Bobby will get you hired. Anything else you'd like to share with our viewers, Dr. Bobbio? Any upcoming projects, any events that you're doing in the office, anything um, in the Brambleton community in the next short few months here?
Yep, we are actually doing a Candy for Cans drive where you can bring in any of that extra Halloween candy that you don't want to eat or you don't want your family to eat. You can bring to my office any non-perishable food items. This is all going to go to the Loudon Hunger Relief. And it's a great cause, and it's a great way to give back to the community. We're doing it for the whole month of November. So anytime you want to stop by, or if you even wanted to send me a message on social media, I would come to your house and pick it up.
Oh, wow. And where can everyone find you, Dr. Bobbio, if they want to book an appointment, if they're in the Brambleton area, where do they go?
Sure. So we have multiple places where you can find us. BobbioFamilyDental.com is our website. So you can go on there, book an appointment. We are on Instagram and Facebook. I think we just started a TikTok and a YouTube, which is was so uncomfortable for me, but again, scared, but doing it anyways. Bobbio Family Dental on Instagram, Facebook, I believe TikTok, and YouTube now.
Awesome. All right, Dr. Bobbio, thank you so much for being on, and we appreciate your time.
Thank you so much, Dr. Keith. I'm so, so grateful for this time with you. So I really appreciate it.
Awesome. All right, we'll see you next time.
Thanks.